This upper hip bone has two expanded blades, right? The upper one above the acetabular foramen is the, and laterally there is a socket, all right. The above one is the ilium. Behind the socket, the part, thick part is the ischium, all right. And below and in front, this part is the pubis. And in between the ischium and pubis, there is a foramen, that is the obturator foramen. All right. Then he will go to describe that ilium has an upper end, a lower end, all right, an anterior border and a posterior border, all right, and a medial border. There is a medial border, all right. So at the anterior end, this is the anterosuperior iliac spine, and this is the pubic tubercle. In between these two, the inguinal ligament is like this, all right. The femoral nerve, femoral artery, femoral vein are going down in between this gap. Understood? In the outer surface, you see there are three lines: inferior gluteal line, anterior gluteal line, and the posterior gluteal line. All right. In between this area, behind is the gluteus maximus. Behind is the gluteus maximus. In between is the gluteus medius, and anteriorly that is gluteus minimus. This is the, you can see that is straight head like this, straight head and deflected head of rectus femoris like this. I have drawn it. All right.
Sir,
how much time you have passed after attending the class? How much time you have passed after attending the class? You are not allowed after, before 1 hour.
Sorry, sir.
Hold it. So this is the anterior border of ilium. There is anterior superior iliac spine, a depression, and there is anterior inferior iliac spine. This is posterior superior iliac spine. There is a depression, that is posterior inferior iliac spine. All right. This notch is called greater sciatic notch, and below this is the lesser sciatic notch. This will become a foramen when sacrotuberous ligament. You see, when the sacrotuberous ligament, when there will be sacrotuberous ligament and sacrospinous ligament, these two notch will convert into greater sciatic foramen and lesser sciatic foramen. বোঝা গেল এই যে স্পাইনটা sacrospinous ligament, this sacrotuberous ligament. So those two notches are converted into greater sciatic foramen and lesser sciatic foramen. All right. Now pubis has a body, superior ramus, inferior ramus. Inferior ramus go to join with the ramus of ischium. Then it completes the arch. Pubis has two ramus. This is the superior ramus, this is the inferior ramus. This inferior ramus goes to unite with the ramus of ischium. So these two are united, right? Now you look at the, for the sake of hip joint, you look at this surface. You look this acetabular cup. There you will find one lunate surface. The articular surface is not like this, not the cup. The articular surface is around the wall of the cup. That is the lunate surface. And below there is a notch in between the lower end of this lunate surface. All right. This notch gives another ligament, that is called transverse acetabular ligament. The lower end of this notch gives rise to like this transverse acetabular ligament, as I have drawn. All right. And through this transverse acetabular ligament, branches of medial circumflex artery, obturator artery, this enters the cavity to supply the head of the femur. All right. তোমার তো ফিমারটা নিয়ে আসেনি, ঠিক আছে? This ischial tuberosity, it is called the sitting buttress. When we sit, we sit on this heavy bone, and there is, you see, there are spaces, 4 spaces. The upper and medial one is the semimembranosus. These are hamstrings. This is semimembranosus. This is semitendinosus with short head of biceps. This is ischial fibers of adductor magnus. And there lies the fatty tissue on which we sit. There lies the fatty tissue on which we sit. Below the obturator foramen, you find the obturator externus, then comes the adductor magnus. This one is the adductor longus. Draw the diagram, go on drawing and put the name. This one is the adductor longus. This one is the adductor brevis. This one is the gracilis. And this one is the extended limb of the adductor magnus. ঠিক আছে? এইটুকু, this much, this is tensor fascia lata and this is sartorius. This much you must be able to memorize. All right. I didn't show you the inner surface. আমি তোমাদের inner surface-টা draw করলাম না, আঁকলামও না. I didn't draw it. All right. Now, if you see the head of the femur, you will find there is a depression which is called fovea, and from the fovea there is a ligament which is known as the ligamentum teres femoris, whose base is attached with the transverse acetabular ligament. Here is transverse acetabular ligament in between the lower end of the lunate surface. এই দুটো lunate surface এর নিচে যে নচ আছে তার মাঝখানে transverse acetabular ligament আছে, ঠিক আছে? The transverse acetabular ligament is attached with the base of the ligamentum teres femoris, that is the ligament of the head of the femur, ঠিক আছে? আর এর তলা দিয়ে deep to it passes the acetabular branch of medial circumflex artery as well as the obturator artery, ঠিক আছে? Now, this margin of this acetabular socket, is covered with a fibrocartilaginous rim, which is known as to deepen the socket, which is known as the labrum, and the capsule, the head is covered by the hyaline cartilage as usual for a synovial joint. All right. This hyaline cartilage is thickest at the center and thin at the periphery. Right. Now, at the center of this acetabular socket, we have some fatty tissue. All right. And the fatty tissue is beyond the synovial membrane. That is, synovial membrane is above the fatty tissue. All right. And the fatty tissue is close to the bone. বোঝা গেল? fatty tissue-টা এর সাথে বোনের কাছে আছে, close to the bone, and it is layered by a layer of synovial membrane. So the fat is intracapsular but extrasynovial. You should know this term. You have to write this term many times in anatomy. So it is within the capsule but not within the synovial membrane. It is intracapsular but extrasynovial. All right. So the cone of the ligamentum teres is attached to the base, and deep to it passes the acetabular branches of obturator artery and medial circumflex femoral artery. Right. Now, take into cognizance some of the muscles of which number one, hamstring. You need to memorize the hamstring. That is, this one is the semimembranosus. আমি আর পারছি না বারবার যেতে, ঠিক আছে? এই সুজয় সুজয় তো পেনগুলো তো না মার্কার পেনগুলো ও থ্যাংক ইউ দিদি থ্যাংক ইউ এটা ব্যাক করে দিই Oh, sorry. So I have written, this is adductor longus, this one is adductor brevis, this one is the gracilis, and these fibers are the adductor magnus. This one is the obturator externus. This is the obturator foramen. All right. This is pectineus and this is quadratus femoris. This one is quadratus femoris. So the fibers, the muscle fibers which are already originating from the ischial tuberosity, that is the semimembranosus, semitendinosus, short head of biceps and ischial fibers of the adductor magnus. This makes the hamstring muscle. This makes the hamstring muscle. All right. Now let us consider the formation of hip joint. You will describe in a manner, first 1.5 line or 1 to 2 lines of introduction, then you give bones, describe the bones forming the joint. Bones forming the joint. So femoral head is described, it is globular. It is globular. Roughly 3/4 part of a spherical object, and this head is connected with the acetabular socket, and at the top there is a rough area for the attachment of ligamentum femoris. All right, this head, people say that this is a multi-axial ball and socket joint, but I have a difference. I will tell you later on. All right, what is the difference between a ball and socket joint and a transverse pivot joint? It is a transverse pivot joint. What is the difference? I will tell you later on. All right. Now how to describe the socket? That it has a lunate surface, which is an anterior end, one posterior end, and then posterior superior end. This is like this. This is like this. There is an anterior end, there is a posterior end, and there is a posterior superior end. All right. In the posterior superior part of this lunate surface, there is formation of a buttress. There is formation of a buttress. What is the meaning of buttress? What is the meaning of buttress? What is the meaning of buttress, Didi? Buttress is a outward projecting bony ridge. Buttress is a outward projecting thick bony ridge that transmits the force of impingement or force of impingement. ठीक है? If you clench your teeth, there will be some bony buttresses in this area. Just after the 2 incisor teeth, you find it, there will be thick bony ridge. All right, this is called buttressing. Have you seen the umbilica officinalis tree or Chebulia myrobalan, হরিতকি, আমলা and বহেরা? এই গাছগুলো দেখেছো এইরকম হয়। These trees are like this. This is the stem root. From this part, ridges come out. To hold the from the stem root, some thick ridges come out. These are called root buttress. These are called root buttress. পড়োনি তোমরা আমলকি, হর্তুকি, বয়রা এই গাছগুলোর কি হয়? রুট বাট্রেস পাওয়া যায়। ভুলে গিয়েছো? পড়োনি তোমরা? এতে হতে পারে? কখনো হতে পারে না। Scientific name of amla is Umbilica officinalis. That of Bohera is Chebulia myrobalan. ঠিক আছে? So these trees are supported like these extended ridges. these are called buttressing, right? So at the posterior superior aspect of this lunate surface, there is a buttress which projects towards the cavity and holds the acetabular head. কি করে ওখানে একটা তাকের মতো self like buttressing, all right, and it holds the acetabular head. In case of female, this buttress grows by 2 months. This buttress goes by 2 months. In case of female, if it is not found, there will be congenital dislocation of hip that is mostly seen in females. Due to its non-formation of this buttress. All right. Now you know the head. Now you know the acetabular cup. You know the head surface and the acetabular cup. Now the factors that are uniting this joint. Thank you. If I draw another figure for the relationship of the hip joint, you will not be able to place those muscles where it is located. আমি যদি একটা হিপ জয়েন্টের রিলেশনের একটা ছবি এঁকে দিই, ঠিক আছে, you will not be able to, one thing, that is the above the piriformis, the vessels and nerve that is supplying the gluteus maximus, medius and minimus, that is the superior gluteal nerve and vessel. This one is the above the piriformis, this is superior gluteal vessels and nerve. All right. Below the piriformis is the inferior gluteal vessels and nerve. Our aim is to, whenever we read anything in anatomy, the first thing is whether we can locate any muscle, any vein or nerve. আমরা locate করতে পারছি কিনা সেটা আমাদের সবচেয়ে বেশি ইম্পর্টেন্ট, ঠিক আছে? If I say superior gluteal vessels or nerve, ঠিক আছে, it is not important that you tell all the branches serially. It is not important. But it is important where is the superior gluteal nerve? Where is the superior gluteal nerve? Where is the superior gluteal vessels? This memory of localizing any structure, all right. Where is the sartorius muscle? Oh, this one is the sartorius muscle, right? So in between this is iliacus, pectineus, psoas major, iliacus, psoas major, pectineus, all right, and then adductor longus. If you can memorize where it is, 80% of your job is done. 80% of your job is done. All right. When you read osteology, it is important to memorize which muscle is where. Reading hip bone, because then in the next class I will conclude this hip joint. All right. ঠিক আছে? Thank you all.